So, dear colleagues, thank you for coming here in this Amsterdam afternoon. I will talk about how do I achieve the intraoperative fluorescein angio. And as Alan said, we all touched on the angio in a different way and in different approaches. There is a consensus that it is a doable thing with the Ingenuity system. And now I do think that we need to optimize the settings. Somehow, if we have colleagues which should be or would want to be early adopters of this imaging modality, to have a consistent images. Because up to now, the settings are shared from mouth to mouth, from colleague to colleague, but they are not standardized, let's say, or they are not optimized in terms of maximum image quality. And I'm afraid that if some images are not good enough, the early adopters might say, this is not good for me and I will not use it. There are, of course, clinical applications that we know it, and there are mainly vascular ones. So I will talk about, I will talk about how to optimize the imaging, the light source, the exciter, the barrier filters. Should we use optical barrier filters or not, because there are different approaches. So here are my disclosures, one of which is related to the presentation. And basically, what is digital intraoperative FFA? The main thing that we need to capture is the fluorescence signal and the intensity that we can have. So how do we achieve it? With illumination excitation, with a bandpass filtering, and most importantly, with the Ingenuity, we have a camera with high sensitivity and high dynamic range. Bit off topic, the camera of the Ingenuity is capable even of infrared imaging. So it's, there is a broad spectrum of imaging modalities that we might use. But in my opinion, the center of the best image for the FFA is the contrast, meaning that the difference between the contrast of the tissues is the one that we want to capture in order to have a good image. I will start with the fluorescein solution spectral wavelength. The peak is in 580 nanometers, but the total bandwidth when it's lighted with white light, not excited light, is in between 550 up to 660. So when you have your fluorescein solution as a specimen, and when you shine excitation light with a different excitation filters, for example, Semrock 475 or Clarity 475, we actually get fairly similar picture with a peak of fluorescence around 535, 540. Why this is important for us? We are using the classic way of achieving that is to put the optical barrier filter on the microscope, which the peak wavelength is 525, and the total bandwidth is in between 520 to 540. All this technicality comes to the laser filter. The laser filter is actually a problem because it reduces the intensity of that wavelength exactly where it is the peak of the fluorescence solution. So one of the workarounds is to have a swivel in and off filter like the PurePoint one, but there are dichroic filters like the Iridex one, which are there. So you are losing from your fluorescence from the setting. If you have your laser filter, you will lose from the fluorescence image. Then, what is happening? How do we achieve it? I am using Alcon Constellation as an end-illumination light source, which is modified to accommodate the excitation filter. It's funny that the Constellation machine is, correct me if I'm wrong, but at least 15 years of age, and somebody thought about that. There is a tray where you can mount a filter inside. It's pre-built there. So you put the exciter filter, you achieve the fluorescence, but when you use a barrier filter and it is optical one, and you have a laser filters, as I said, you might have a suboptimal fluorescence to see.
Just a second.
Yeah, okay.
They're sharing screen. Okay. That's what they're seeing. Yeah.
So, how do I change
There.
with this?
There you go.
This is what I was talking about. This is the constellation end illumination model. On the right side, it's a photon. It's fairly easy to accommodate an exciter filter with some metalworking, but the photon as a source, in my personal opinion, is not good enough. Why? You will see. These are the spectral characteristics of the constellation, xenotron, photon 2, and dark LAD. So the most consistent wavelength or a bandwidth of end illumination is actually on the constellation, and you don't have ultraviolet spectrum there. On the xenotron, you have an ultraviolet. On the photon, I think it's focused on 532, 577 wavelengths. It's an assumption for safety. And the dark LED, they have, of course, inherited blue light peak because this is LED technology. I haven't experimented with this light source. I just have the spectrum. So these are the excitation filters that you might find. There are plenty of them. These are the ones that I tried. Clarity 475, Omega 490, Semrock 475, and Leica 476. My personal recommendation would be to find the Semrock Brightline 475 because it's easier to find. The clarity is, let's say, a bit tricky to find. Barrier filter. My approach is that I don't use optical barrier filter because I think that the optical barrier filter might filter more from the image data than it needs to be filtered. Because this is the classic way as done in the fundus cameras. I'm using color channels to create a custom pseudo barrier filter with the digital head of the Ingenuity. That way you can use it on every microscope, provided that you have Ingenuity. So this is the first video. This is a HRMD patient, but there was a hemophthalmos. This is the reason for the vitrectomy. But the image is quite nice. And here the image is achieved with the Ingenuity mounted on a Revalia microscope. So this is the next step, to optimize the filter for the microscope, because the size like Alcon Mueller video, they have different optical transparencies, meaning that they have different contrast in the image. With the Ingenuity, we are able to provide or to change the sensitivity of the camera with the gain, and we can somehow adjust or create personal profiles for the microscope. So here is the image. There are a lot of types of digital filters with green tint, with blue tint, but I do believe that the black and white representation provides, wait a second, provides the best contrast, because this is dark white contrast, and we are familiar with it from the fluorescein angio that we are used to see in our ambulatory examinations. So here is a case of peripheral occlusive vasculitis where I used the intra-op fluorescein angio to guide my laser, to guide the area of the ischemia in order to not damage all the retina, because I don't know where are the fields of the ischemia. So this is one of the main advantages. It turns the Ingenuity system from visualization system to a diagnostic tool or even intraoperative navigational tool. So you see how selective is the laser here. In the next video, this is a diabetic case where after the vitrectomy and cleaning the hem of thalamus, you can appreciate the areas of ischemia and if there is a leakage or not from the optic nerve or in the macular region. But the next thing that I started to do is intraoperative fluorescein guided laser or endolaser. In that way, we don't damage the remnants of the healthy retina, and we can be highly selective in our laser therapy. And I do believe that on top of all that ischemia, if we reduce the inflammation from the laser burns, it will lead us to a better post-operative outcomes and better prognosis for this eye. You can see clearly well the areas of ischemia. You can actually, in the early phases, you can see the capillary dropouts. Later on, you can even judge how is the choroidal perfusion, because depending on the light intensity, you might see that. Here, what is important that I achieve this image with chandelier. Chandelier light is quite forgiving, and it is quite safe. And it allows me to indent myself and to find the areas of ischemia. So I do find this as a beneficial thing with the intraoperative fluorescein angio. Then in the next image, it's something else. It's called fluoroscopic vitrectomy. And if you have a small amount with low concentration of fluorescein in the eye, you might see perfectly well the layers of the vitreous, and especially in the periphery, you might see the base of the vitreous and the lower layer. Here you can see a vitreoretinal adhesion, which can be trimmed fairly safely, because simply I see what I'm removing without touching the retina or creating additional break. You can see my Specs 500 vacuum. I'm not afraid because I see what I'm removing here. And last but not least, if you want to use this same modality in anterior segment, you might have anterior segment illumination, which is a LED from starlight with the same excitation wavelength, and you might achieve anterior segment fluorescein angio. So you can see the vessels here. This is a pseudo-exfoliative patient. You saw the edge of the pupil. These are here the collector channels, and this is a case with iris cyst. But what is important to see is the vessels on the conjunctiva. So it depends to be seen where this modality will be used in the anterior segment. I want to show that with the ingenuity you can achieve angio in the anterior segment also, not only in the posterior. And I think that's it. Thank you.
So you use the laser without the filter or with the filter?
With the filter. The trick is to increase the gain of your camera. Otherwise, it will be more, you will lose contrast. And with the same setting where you achieve your intraoperative angio, you just increase the gain. And it will help. It will help.
I have actually the swivel of the filter, so when I do the fluorescein, I just turn it off. Right?
Yes, but later on to do the fluorescein angio guided laser, you need to have the filter on.
Wonderful presentation. What settings do you use to get the black and white?
It's a digital filter recipe, which at the moment I cannot disclose, but you need to play with your color channels. The black and white actually is the last part of the recipe. Before that, you need to adjust other things in order to capture the fluorescence. One of the ways to find this sweet spot for you is you need to excite your fluorescence solution and to try to find the fluorescence in capillary tube or something which is transparent. But the exact recipe I cannot disclose in the moment.
I think one thing that I want to try to do is with version 1.5 for Ingenuity, they can do simulations. If you send them video, Alcon can now do simulations and optimize that. So that's going to be something that I'm going to beg the vision scientists to help us with some of these simulations, because I think you've done a great job of ferreting out the exciter filter. We had just, Michael had helped me and was great. We got several different filters which we tried out. We did the same thing. We didn't do capillary tubes. We just did in vivo, but we actually came upon a similar thing. The Semrock filter was good.
Yeah, it's good, the Semrock.
Edmunds has a filter that's good. We were both at around 480 to 485. The 470 wasn't good, but I guess 475 to that 485 worked well for us. Again,
it depends from your digital recipe, because probably my focus was around 475, because Clarity and Semrock are 75. Yeah, probably that is why you have different results we are more focused on 490 or 480 something. But I don't think that 5 nanometers wavelength are so determinant.
Those band filters have a plus minus anyhow.
Yeah.
They've got a peak.
This is another thing that we need to mention. There are wide wavelength or bandwidth filters and notch ones. I have General Electric notch filter, which is actually 10 nanometers. That's it. Yeah. It doesn't do a good job for me. Around 30 nanometers bandwidth is enough to have enough resolution. The contrast you can get is with fairly coherent light. For example, if we have a laser light source, we will not use exciter filters, but we will have the specific and fairly coherent exciter light. Probably this is the next thing that might enhance the contrast in the image.
Excuse me, and when do you turn the exciter filter on? During the surgery?
When I start to do the fluorescein angio.
So you open the constellation?
No. The constellation, you have, in my constellation, I have 2 units with 4 ports. So you can use either of these ports for that.
We actually, that's not something we can publish, but we got another approach. So I use the high diode, which is
LED, yeah.
Yeah, 450, and I connect it directly to the illuminator. So that's what you just switch the illuminator for the part with the angiography.
Yeah, it doesn't matter. I have a bunch of outside end illumination sources which I tested, and it's exactly the same. I just put the light fiber there. You need to be sure that the coupling will be the same, so a bit of metal work, or tape, something like that, just to prove your point. Yeah, this is the way that I reached to the conclusion that the constellation illumination model is the sweet spot, especially if you have a new light bulb. You have enough intensity, consistency of the bandwidth, and I abandoned the others.
Okay. So I think one of the key points, and I don't know the answer to this, I know in the US, Alcon, we have fluorescein. I can't even get the technical documents for that, because I would like to know what the peak sweet spot fluorescence is. But in other countries, in France, there was another brand, and I'm sure there's other brands making fluorescence. And do they all have
different ones?
So it might depend on your dilution, the brand of fluorescein that you have, along with matching that with the correct excitation filter.
If you have a spectrometer, which is not a big deal, you can have it. This is the fluorescein that we are using. I think it is from Turkey, so it's not a Novartis one or but they should be more or less similar, because I tried different brands and I have consistent results with my settings.
It's good.
Yeah. But you're right, it's a matter of dilution. Yeah.
One other thing that we were talking about before, and it's come up when we've presented, is the concern that blue light may be toxic to the retina, or blue light combined with fluorescein is toxic to the retina.
I did a research on that, and there is a really good classification, international one, which shows that everything above 440 nanometers is basically comparable in terms of phototoxicity with the white light. Everything under 440 is dangerous. So all our device like a Spectralis or like a Optos, for the autofluorescence, they are using 488. So why there should be an issue? And it's a matter of intensity. I do agree that with the light, the straight light pipe, if we are too close to the retina, we might induce something. But with chandelier, Michael, correct me if I'm wrong, there is no danger.
You're correct. I mean, we all, those of you who were at the Club Donan meeting this morning, the young lady that presented the phototoxicity paper, it's intensity, it's also the distance to the retina and the time. So you get a time, and chandelier is extremely safe. From a constellation perspective, everything's filtered out from 435 nanometers down. And we've done that for 15 years, and there hasn't been an increase in phototoxicity reports since our old xenon on the Acurus, where we had less filtration. So in my mind, not that I'm a doctor or a scientist or whatever you guys are, we're not going below 435. You use
Definitely.
above that. You're aiming for around 480 to 515. It's blue-green.
Yeah.
And what we've been doing with Alan is chandelier at 100% and a light pipe. We're actually putting more in. And at the beginning of the case, we're putting a little bit of gain in while it's all blacked out, waiting for the fluorescent to come through. And as it comes through, we start backing the gain off. So then we get good contrast as well from that.
The other thing to mention here is the slider of the Ingenuity. Yeah. You can play with it because it affects the exposure, but the depth of field also. But anyways, in the fluorescein angio, you might want to go in between 80 to 100 just to get the fluorescence. Later on, when you start to work under the angio view, you might close it a little bit and titrate the gain, as Michael said.
Yeah. As you open that iris, if you do it fully open, you're going to get a little more refractive errors, so the focus won't look at
Yeah, depth of field is shallow. Yeah.
As you close it too much, you're going to get more diffractive errors.
May I ask, the 532 nanometer filter for the laser,
Yeah.
did you use it or you didn't use it, I think?
No, at the beginning I used it and I realized that it alters my imaging. So then I started to remove the filter, then I sourced a swiveled one, which you can use during your normal procedure, and then you can swivel out the filter when you want to see the angio image, and when you want to work under angio visualization for the laser, you need to put back the filter, and the workaround is to increase the gain of the camera, not of the illumination. Because if you increase the gain of the camera, you increase the noise in the image. But anyways, there should be a balance in between. So my way is to increase the gain.
But I had the impression in your film that you could see the laser intensity, so
Yeah.
it was not filtered out.
No, it is, but it's another thing. In the digital recipe, you actually increase exactly the green spectrum, 532, in between 530 to 540. So the filter captures more light, because the optical filter, if we return to the optical filter, let me see where it is. The optical filter is a notch, but it doesn't remove the green light. You see the Iridex one, you have 0.1, what is the value there, and in the pure point you have 0.3. So I still have the green spectrum, but it's suppressed. But the digital filter is actually capturing this. That is why you have, yeah?
So you're absolutely right. And some of you guys may have a pure point, but you may not be using the pure point filter. You might be using a Zeiss filter or something else. The optical density is very different in most of these. We have an optical density of 4 on our filters. Many of the others are more. They tend to be multi-spectrum, for infrared and other things. They tend to be a different color. So that affects the final image as well.
Yeah.
You want to have that light pink color, then you know you're going to be a green filtration filter, 532, and not too dense. So the optimization of the image actually depends on every link of your setup, from the microscope through the filters to everything. And you have to do some dialing in. Everybody's system's going to be a little bit different. Yeah. But let me also say, if it's 100% for your chandelier, the output at 100% on a straight light pipe is different. We don't equate power the same way. We look at each light fiber in terms of the phototoxic effect and give you a certain amount of power. So for a 20 gauge light pipe, we allow you to have more power. But for less power. For a chandelier, we let you have much more. So 100% on one light pipe is not the same as 100% on a different gauge or a different type of light. Yeah. But we maxed it out. We went 115%, 100% chandelier, straight light pipe, a little bit of gain to start with, then we back the gain off as the fluorescence starts coming in.
Yeah, and then it's just common sense. If you're using your straight light pipe, don't hold it in one place for 5 minutes. And just like in the clinic, the fluorescein signal rinses out after about 5 to 7 minutes anyway. So it's not like you're going to be holding it's not like you're going to have the fluorescein in the eye for a long period of time. So let's... Hello everyone, can you hear me? Yes? Yes.
How are you? Tim here from the Dominican Republic. Really nice presentation, Lukan. I want to ask you, what iris aperture do you use when you're using your technique? I know you're more of a game changer than the light, the power of the light, from what you've told us. But what we found is that when we up the gain too much, we get a lot more of a grainier image. I don't know if maybe lowering the iris and elevating the gain will give us a more of a smoother image than grainier.
Hi Nas, I always aim for the lowest possible gain because the image will be cleaner, and I prefer to have open iris as in the photography, but not increasing the gain. The gain will definitely bring noise, which relates to grainy picture. So less gain, more light, I would say. So aperture or
your light source.
You can. I do believe that the light source is the key of the good contrast in the image, not our recipes, filters, and the quality of the exciting light source, I think, is the key.
Okay, very good. Thank you.
But another element, if you're using ingenuity, and some of the presentations I've seen at the meeting here, I don't know if you noticed across the top of the screen, you'll see increased exposure to flash camera. It's really important, especially with this, to do that. If the sensors are not fully energized, you're going to get grainy image to start with. So make sure you have your Alpine representative show you how to do that if you don't know. But basically, you've got to expose the sensors to a lot of light at the beginning of your day. And as long as you don't turn the machine off, it should be okay after that.
What do you mean by a lot of light? You mean white paper?
Just make it brighter. So what I like to do is I like to close the iris have the microscope light off to start with, put a piece of white paper directly underneath, turn the microscope light on as bright as I can go, and open the iris and make sure that that wording has disappeared, but don't pull the paper away immediately. Keep it there for another
few seconds it's
Like
needed.
white
Yeah.
balance, right?
It's like a white balance, but it's energizing the senses so that they're at their peak sensitivity.
It's a matter of seconds, right?
Yes,
Yeah.
but don't pull it away as soon as you see the thing disappear. It's the same with the white balance. Many people don't do a white balance correctly. It says it's done, but it's not. It just needs another second or two to fully capture it.